Okay, welcome. I'm Eric Chong and I'm the CEO of UpgradeMyPractice.com. We've owned and now work with dental practices that earn at least $3 million a year to help them grow and set up their practice for exit within 3 to 5 years so they don't ever have to worry about working inside their practice and or making money from their practice ever again. The reason for this training is for any dentist or dental practices making less than $3 million per year. It's to help you get there in hopes to make things easier when we choose, if and when we choose to work together. All right, so let's go ahead and get right into it. This is the WIN medical billing for dental. And I'm going to be covering why now. That's the specific question. If you're not already doing medical billing or you're not implementing, really medical billing is just what I say because I think that's what people relate to. But really what we're talking about is this health starts from mouth system, right? Not just being a dentist, but being a doctor of your practice. So whether you want to call it the health starts from mouth system or doing medical billing for your dental procedures or your dental practice, this is going to cover the why now. This is a very important video because over these years that we have on the screen here from 2024, which is coming up very soon, depending on when you're watching this video, or maybe it's already 24, and over the next 10 years, why this is not just the best decade in dental, but why this is going to be an incredible opportunity that you're never, ever going to be able to get, and we probably won't ever see again. We never have seen this opportunity before, that's for sure. But after you see the information on this presentation, I think you'll realize why this is the only time we'll have this window, because there's a lot shifting, and usually when things shift during transition, we have the greatest opportunity, right? So when it comes to the highest revenue business in the US, I don't need to preach to the choir. We already know it's dental, but most of the dentists that I talk to are just not getting paid the amount that they expected or that they deserve. So when you look at these DSOs coming into the dental space, this is exactly why they're coming in. They see it by number, they see it and they're excited about it. It's never going to stop, DSOs coming in, until private practices or dentists learn how to do their practices or run their practices the right way, and they start being competitive where the DSOs don't find it worth competing anymore. But I'm going to be honest, if I was a DSO, and we've started a DSO of sorts in a way in the past, is because it was just way too easy. And the more you don't do this, the medical billing or the health starts from mouth system, and you don't have to choose this way, but something to address this problem, the easier and easier it is going to be for this DSOs just to take the market by storm. And they're not even onto this stuff yet. When they do get onto medical billing, it's going to be impossible, actually, for a dental practice that's not doing it to keep up. All right, so when to do medical billing for dental, when should I do it? When do I do it in the procedure or when I see the patient? And when should I even start this whole process? Is this something that I just wait a couple of years on? Do I wait till I'm an advanced dentist, or do I start immediately? So let's just address that up front. I encourage all dentists to get registered for their P10 regardless of the clinical skill set or ability, because it's simply a registration. You want to register with the federal government. It doesn't cost anything to register, unless if you pay someone to do it for you. But just the registration itself doesn't cost anything. It's letting the government know that you are a doctor of the mouth. So I recommend all dentists do it. But in specifically this video, in this section, what we're going to be covering is the Blue Ocean for dental practices. Why it's now and how we're going to take advantage of it, and why Medicare for dental. We went in and talked about Medicare, and a lot of people may be asking why not the other insurances. I'm going to go over exactly why Medicare and why not the other commercial payers or the other medical payers, and then What we're going to also be going over is just asking every patient. It's a reminder. It's a must. If you're going to be doing medical billing, you just want to ask, right? It's like having a store and not asking for money at the register. You just want to make sure that you do it. And then Medicare claim to payment, we'll talk about how that process goes, the time it takes, what's the difference between Medicare versus medical claims, and why the next 10 years is going to be the best for dentists. Okay, and then we'll end with the 12-month window that you have. And the clock is ticking every day that goes by. Your 12-month window moves, it shifts. So it's a very important thing to understand. All right, so in 2030, and really it's already started, it's been going on, and it's been the silent largest demand that's been hidden from dentists. And there's a couple of factors that are driving it. We've been talking about it in the other videos. Some of the things that we've addressed, and some of the things are much larger trends that we haven't even talked about. And I didn't. I just felt to skip it because, you know, we all know that AI is happening. We all know that collaboration of healthcare is coming because everybody knows that the mouth is part of the body. Arizona already changed the law. Arizona's the first state to cover dental, you know, for veterans. And there's all these laws that are starting to change. So if you don't already know that, then that's okay. I'm telling you now. But it will be too late if you just, you know, let the next couple of years go by and you don't pay attention or you don't understand this stuff. So you already know that you're a doctor, you know, or dentists are doctors, and that dental is medical. But we really want to understand how we can run our practice in a way that supports health starting from the mouth. Because there's a very big difference between the way most dental offices are run and doing conventional dentistry and how dentist practices should or could be run with the understanding, tools, and resources that we have now. Practice mastery. So what I mean by that is as we shift the clinical side of dentists are so good mostly for, you know, doing the good work, and they're great at the clinical ability. But what we really need to work on as supporting team members, admin, or as dentists to help our admin support you better is to get the practice or the admin and the business details right so we can keep up with or support the clinical advancements or the clinical level that you're at. It's far too unfortunate to see a doctor that has mastered their clinical ability, but the practice is just lagging behind and suffering and really holding that doctor back. That's the last thing I like to see because dentists are doctors and the rock stars of healthcare. But I digress. You know, that's for the other videos. All right, so why Medicare for dental? It is the gold standard for all health plans. They set the gold standard. They tend to lead as far as setting precedent for how policies make rules and run their policies. That's why I really like Medicare, because they allow the doctor to be a doctor, right? It's not like commercial insurance companies that try to be a pseudo doctor or try to prevent treatment. They actually think that saving money for their CEOs is more important than life or the promise of their health plan, which I truly believe has to change. It's not okay that these executives are getting paid out and there's not just one or two deaths. We're talking about millions, couple million deaths a year because some people want to get rich. But I digress. Medicare doesn't do that. They allow doctors to be a doctor. And it is the single best player, not just by rating or reputation. They're consistent and they have the largest pot of money. And Medicare pays dentists. That's another reason to love them. Not just dentists, they pay all providers. They pay all physicians, anybody with an NPI really, Medicare pays. Happy patients, not just because when you're 65 and older, you're retired and you tend to be happier. Medicare takes care of their patients quite well. I know there's a lot of people that are upset with Medicare or they're disappointed, but I really think this is the biggest missing piece of the puzzle. If they get and they are able to get care for their mouth under their Medicare, usually all of their symptoms, pain, and diseases go away. So that's why I'm also so happy about this program. Any Medicare patients that find out that their dentist is going to help or support them to use their Medicare benefits, they're happy, they're excited, and they're going to tell all of their friends and their family. Medicare is also great because it helps to increase your revenue. Again, this isn't just about the money, but this is more about recouping the most valuable part of the work that you're doing, or getting paid for the work that you've always done but never gotten paid for. It also helps protect your practice because once you're registered, you're seen as a doctor, not just a dentist. So you are due your medical payment, and this is how you protect yourself. If anybody comes knocking or asking for questions, you'll not only have the credentialing, but we'll share with you and show you exactly how our other doctors have kept records to just show that the work was done for medical reasons and health reasons first, and they were the only ones that can do it because they were a dentist, right? And not that that's the way that it's written, but we'll share with you the samples. And at the end of the day, Medicare can and should protect your practice to keep it safe and keep your profit safe. And at the end of the day, what that does is that lowers your overhead, lowers your liability, lowers your risk, and it improves your profitability. So there's so many more reasons why, but I would say these are some of the top reasons why Medicare for dentists or dental practices. So ask every patient, right? That's what this is about. Especially in the US, anybody that's 65 and older, they have this card or something that looks like it. They usually know the patients, or the people when they have Medicare, but they don't always. So sometimes you can just check for them as well. Anybody that's 65 and older and that's lived in the US or a US citizen, they have it. It's just something that's given to everybody that's 65 and older. So even if they don't think they have it, you can search for it by calling Medicare and using their social. But anybody that has a chronic condition also qualifies. So I've seen people as low as, in the 20s have Medicare plans. And then you want to ask them if they don't have Medicare. It gets a little bit more difficult, but and it's not for this training, but there's a lot of other things that we can do, right? So there's medical plans that you can bill for, health savings accounts, auto, and even workers' comp plans will pay dentists if and when the case qualifies. But again, all of that, we go into more detail in our health planning process. The important thing to know here is that just by doing Medicare, though, you will greatly decrease the amount of patients that you say no to, and you'll be able to make a lot more money. So you'll be able to help a lot more patients. All right, so the Medicare claim to payment process, it's just about 10 to 14 days for Medicare. I get this question a lot from dentists that are wondering whether dental is faster or whether medical is faster. And in most cases, I would say Medicare wins because it's just about 2 weeks. Of course, the first payment takes a little longer. It takes about 90 days. But usually, or not usually, after that, after the first payment, after they do the checks, then you're good to go. And it's just about 10 to 14 business days after that. So the reason why we talk about Medicare so much, and the why Medicare is not just the area where we want to stay because it's easier, but you're going to find that aside from the difficulty and the claim process, the confusing claim process, there's just higher demand in Medicare. But if it not the demand alone, I just want to share with you what to expect. So with Medicare, it's very simple, right? You just see the patient, you do the treatment, you send in the claim, and then you get paid. So it's very straightforward. It's very simple. You don't really have to make any changes to your practice or the way that you do your work. The reason why I am not a big fan of all of the other medical payers, like all of the other big insurance companies out there, is because it requires you to change the way that you practice a little bit, or it just puts too many reasons for stop and failure into the treatment planning or the patient process. So what I mean is, for medical insurance, you see the patient, and then you usually have to go through some kind of pre-approval process for any, even moderate or definitely major service. So then After you get the pre-approval, you do the treatment, but it's not over from there. Then they go to review the claim and to make sure and confirm it. And all of that has to happen before getting paid. So with Medicare, you just do the work. You help the patients and you get paid usually within a couple of weeks. With Medicare, you can see a patient and you cannot do the work because the pre-approval process takes 3 to 6 months and it drags everything out. And then it might be another 3 to 6 months to even receive payment. So it could be a full year before you see one patient fully with commercial medical. Now, we're working on some things to speed that up, streamline it, and put some fire underneath those payers' butts to make them pay. But for now, that's the reason why we don't like medical and why Medicare really takes the cake. All right, so why 2024 to 2035? Why do I keep saying that this is the best for dentists? There's so many other reasons why. I can make a whole class about this presentation itself and this specific part. And I truly believe if you just even understood the numbers, and this isn't anything to have to do with dental, but dentist, I truly believe, is the most, the industry or the dentists are set up to benefit from this transition that I'm going to talk about the most, more than any other business. And you'll see why. So if you haven't seen our other videos on the start videos, you can go back and watch it, and you'll see there's a lot of other statistics I bring about. But our practices are changing, not just the technology in our practices and the clinical skills and the treatments that are using, but literally the patient that we are seeing is changing. I'm not saying it's going from a human being to something else, but the needs of it might as well be, because we are going from patients that used to live to 50, 60, 70, and we didn't have too many people over the age of 85, to now we have a huge, massive segment of our population that is over the age 85, and it is continuing to grow. But the biggest thing to point out is most of the medical need, the need for dentists, the need for doctors, is at those higher ages. And so we're going to see a adapting of our practices and all of healthcare towards servicing the needs of that demographic, right? So that's why I have the cute little granny and grandpa on the screen, the baby boomer demographic, as we now call them. They have children, and by this point most of their children have children. And this next 10 years, because after that, you already know there's going to be other DSOs coming in. Google, Amazon already partnered with Medical One. There's huge companies that are already looking at this space, and they're going to establish foothold. But I say you have at least 5 to 10 years, if not a 15-year window, where they will be the absolute best for you as dentists while this transition happens, because this is an unprecedented challenge. We are seeing a change happen. Everyone's going to have to retool in healthcare, from dealing with a mostly 30, 40, 50 segment to now a 70, 80, 90-year-old or 100-year-old plus patients. Don't you think that that's going to change the way that you practice and the procedures or the patients that you do in your practice? I think so. So not just that, it's not just the money. The money will be one of the biggest opportunities, but you need the money. Money isn't a bad thing. The money is the tool that you need to make it to the next transition, whether you keep your practice where it's at, or whether you evolve, and you go to that next dream practice that you've always been looking to build. And most importantly, over the next 10 years, depending on the way that you practice, you're going to be either seen as the dentist, the doctor, the king, or the queen that you are and should be known as in the health field, or you'll be seen as just another dentist. And it's going to be your choice. It's going to be up to you by the actions you take and how you're registered, more specifically. I shared with you in one of our other videos, when the shutdown happened, it was very clear for me. Most dentists, 99% of dentists, got asked to shut down, even by their own board and their own organization. But our dentists not only got asked They got letters from the federal government, not just begging them to stay open. They even got checks. Almost, some of them, were six-figure checks to stay open. And I very much hope that that never happens again, a shutdown. But if it were, I know that our dentists are prepared, and the dentists working with us will receive even larger checks next time, because dentists are the key to this healthcare system, and the next 10 years, it's going to clearly show that. 70% of all heart disease and breast cancer starts from the mouth, but they are burying that information. 90% of all disease starts from a hidden infection in the mouth that's left to spread. We all know this, but they're not talking about it. They're all selling their hospitals and making those bigger, but they're not doing the service to the dentist, to the patients, and to the people, which matter most, because we are all people first, right? So your 12-month window, it's ticking down every day. This isn't something to, it's not a matter of if you do it. It's a matter of when you do it, how you do it, and who you will do it with. So again, I do urge you to do your research. That's why I've made these videos now, and I'm taking the time to create these, because after 4 or 5 years of leading the industry in medical billing and on the innovative edge of doing it the right way, because we're not the first ones to do this. There's a lot of other people that have. But there's a lot of other people that have also gotten in trouble, and they call us every day for help with their doctors, with their clients, on how to make it through the audits. We're the only ones that have set up the system right, because it's not the medical billing. Again, I'll tell you, it's the health starts from mouth system that allows you to take in patients the right way and set up your practice to see the patients in the right way to do medical billing. So it's not a difficult process, but it is something that I strongly recommend all dentists at least learn about. You want to learn it so that way you know how to do the medical billing in your practice with the health starts from mouth philosophy. Get your doctor's pay, because dental is medical. If you're not already on this page, make sure you go to upgrademypractice.com/learn. On the next section, we will be covering the how to do the medical billing. So we're going to get into the nuts and bolts and the details. In the next section, you're really going to want to stay tuned for that, because you will leave that section with the 1, 2, 3 steps on exactly what to do in your practice. So if you're not already on the page and you haven't downloaded it, you can do so now. Get our cheat sheet. You can download that. Take it with you so you can refer with it anytime you want. Take care, and I'll see you on the next video.